Welcome to Focus on Health, a series of educational programs highlighting current health issues sponsored by the School of Nursing at Salisbury University. I'm Dr. Mary DiBartolo, Professor of Nursing at Salisbury University and host of the program. The topic for today's program is COVID-19 updates with a focus on testing. So I'm having two guests, one of which is Dr. Mark Frana, a microbiology professor with a specialty in virology. And you've been here for quite a while and you have a good bit of lab experience, research lab experience with coronaviruses. Now, Dr. Frana and I are going to talk about the types of tests and some of the terminology and such to give our viewers an understanding of testing for COVID. And then my second guest will be Victoria Lentz, who is a nurse practitioner and Director of Student Health Services here at Salisbury University, and she will address the procedures of how we're going to be testing students, faculty, and staff as we come upon the fall semester. So first, Mark, thank you for coming in today.
Well, thanks for having me. I'm glad to be here.
Now, I know you first wanted to start off with some basic terminology, that of sensitivity and specificity.
Yes. When you talk about the various tests that are involved with COVID-19, both virus tests and antibody tests, you often hear the terms sensitivity and specificity applied to all of those tests. And what they refer to is when we talk about a test sensitivity, we're asking the question that if somebody is positive for virus or antibody, is the test going to detect that? Is the test sensitive enough to pick up a positive result? In specificity, what we're talking about is, does the test only pick up virus that is SARS-CoV-2, or excuse me, SARS coronavirus 2, that's responsible for COVID-19, or the antibodies, or is it possibly picking up something else? So a test that is specific will only pick up the virus itself that's causing COVID-19 or the antibodies that are being produced against the virus. Now, in terms of the types of tests, there are tests that will test for virus, the presence of virus in a patient. And then there are also the tests that are involved with testing for antibodies. Has a patient produced antibodies against this virus?
And of course, if someone's producing antibodies, that means they've been exposed to
Exactly.
virus.
Yes. Antibodies will say that the person has been exposed, and you will see a level in their blood of antibodies increasing or that have increased in response to the virus infection.
And it does take, in this case, a few weeks for one to develop antibodies.
Exactly.
So by that time, you will usually test negative for the virus itself, but start testing positive for the presence of antibodies.
Exactly. So development of antibodies against any pathogen, but in our example we're using SARS-CoV-2, is going to take anywhere from 1 to 3 weeks in order for a patient to develop. And they actually have noticed that in a few patients they actually do not produce antibody. And researchers are trying to figure out why that might be. But in most cases patients will produce antibodies, but it's going to take some time from the initial infection for those antibodies to be produced.
And of course, this ever-evolving scenario, they're still not sure how long those antibodies last either.
Exactly. And that's a big concern, so that when people talk about they've had the disease and they have antibodies against the virus, they probably do have some immunity against being reinfected, although the data on that is not clear. Whether or not somebody can become reinfected. But one of the big question marks is how long will those antibodies last? Will a patient be protected for 6 months or for a year or even longer once they have produced antibodies?
And you would hope that would be the case, because that would
Exactly.
provide immunity, and perhaps you wouldn't need the vaccine, which we're
Right.
hoping for
Right.
in the next
Right.
few months or so.
Exactly.
So now let's focus more on the virus piece, testing for the virus itself, because there's two major categories of testing for that. So could you explain that?
Yes, so virus is composed of a lipid envelope that has a piece of genetic information inside of the virus, which when that piece of genetic information gets into cells is responsible for making more copies of the virus. And so that's the virus RNA. During the process of making the virus particles, proteins are being produced. Virus proteins are also being produced during that process of virus replication. And the gold standard test up until now has been the PCR test that people have heard about, which stands for polymerase chain reaction. And this is a test that is designed to detect the presence of the viral RNA in a patient. And in the PCR test, one of the characteristics of the PCR test, and one of the reasons that it has been kind of a gold standard in the process, has been that it has both high sensitivity and high specificity, meaning that if a patient is infected with a virus, this test has a good chance of detecting that, an excellent chance of detecting that, and it appears to be very specific for only detecting RNA from this coronavirus.
So if you don't have it, it accurately determines that?
Yes, if you don't have it, you will come up negative in the test. One of the reasons that the PCR test is so sensitive is that it's actually an amplification procedure. So when a sample is taken from a patient, say a nasal swab, for example, and processed through this machine, what happens in the machine is that if the RNA is in the sample, the PCR reaction will amplify that amount of genetic information to a point where you can actually detect it. So as a matter of fact, somebody that had a very low amount of RNA in their patient sample, they were just infected or recently infected, it would still show up as a positive in the PCR reaction because of taking this low amount of virus RNA from the patient, but amplifying it to a point where now you can detect it and you can say the patient was positive.
Well, the downside is it's going to take a little longer, though, to get those results, correct?
Yes. For a PCR reaction, it may take a minimum of 24 hours to get that result, and in a lot of cases might take longer than that. In the news, we hear about some situations where it takes considerably longer from the time the sample is collected until the PCR reaction results are available to the patient. So that is a downfall of that.
Well, what about the antigen test? Tell us a little bit about that antigen test.
So the antigen test is looking for the presence of those viral proteins. Remember that I said that in an infection, cells are going to produce new copies of RNA for the virus, but they're also going to produce new viral proteins. And so in the antigen test, what's happening is you're taking that same kind of sample from the patient, but now you're trying to detect the presence of viral proteins that are in that sample or came from that patient. Now, one of the disadvantages of the antigen test is that it's not as sensitive because you're not amplifying the antigen that was produced by the virus. You're just taking a sample from the patient and saying, or asking the question, do they have enough antigen to be detected in this test without any amplification procedure?
So, Mark, it's not as sensitive, but it is a little quicker, correct?
It's considerably quicker. Actually, there are a couple emergency use approved antigen tests that are available, and they're in the neighborhood of say 30 minutes or so where you can get an answer. So the one advantage, or the big advantage of an antigen test, is you can get a quick result. And so a patient that is positive, producing enough antigen, they can know that virtually right away before they would be transmitting to someone else. And that's why there appears to be kind of an effort, even within the state of Maryland, to kind of push towards doing more of these antigen tests because of the quick turnaround for the results. And they're now learning that there is a period in time where people seem to be most likely transmissible to other patients or to other, individuals. And that appears to be a point where the virus level within the patient is relatively high and will be picked up by the antigen test. So the antigen test is not highly sensitive when there's a very low amount of virus, but they also feel like that at that point, if they have a very low amount of virus, they're not yet transmitting it to someone else. It's when they get a higher level that could be detected by the antigen test that they could then potentially transmit to other people.
And are both of these tests, the PCR and the antigen test, done using the nasal swab?
Yes, both can be done using the nasal swab. There are other samples that can be taken, nasopharyngeal and saliva as well, but commonly the nasal swab.
So thank you, Mark, for coming in and explaining all these very important concepts and such. Where do you think we're going with all this? Of course, we know at SU what we're doing.
Yes, so at SU we're going to be using what has been the gold standard test from the beginning of this outbreak. We're going to be using the PCR test in order to survey and analyze both students, faculty, and staff. It may be that in the future, a few months down the road, there might be a transition to the antigen test. That's still not clear, but for the time being, we're using what is considered the gold standard.
Good to go with the evidence and the numbers, correct?
All right, yes, exactly.
Well, thanks again.
All right, thanks for having me.
And coming up next, Victoria Lentz, the Director of Student Health Services. We're back, and I'm here with Victoria Lentz. You are a nurse practitioner and Director of Student Health Services here at Salisbury University. We are socially distanced.
Yes, we are.
Thanks for coming in.
Oh, you're very welcome. Thanks for having me.
You have had a busy few months preparing for what's going to be a significant testing strategy for us to open back up to students this fall. So I know you wanted to come on the program and talk about that.
Yes.
So tell us first about why this is happening.
Okay, so it was decided by the system of the University of Maryland, that is all the University of Maryland schools, that testing would be required for all students, faculty, and staff when they return to campus.
And this testing has to be done within a 14-day window, correct?
So, and we said the 14 days so that you would have your results before you come back to campus in case you're positive, so that you wouldn't come to campus and then you would stay home to self-isolate before you return to campus.
And this applies to all students coming back to campus, faculty and staff. And of course, let's clarify, any students that have elected to or are taking all their courses online and don't need to come to campus, this doesn't apply to them.
They do not need to do that. And even faculty who may be completely online. But if you're going to come to campus to go in your office or do something, pick up your parking pass or anything like that, you need to have a test.
Yeah.
Or teach.
Yeah, there's some faculty doing hybrid format and so forth, or all face-to-face in some cases. So where exactly is the testing going to occur, this initial screening, I should say?
Okay, so the initial screening will be held at the Court Plaza complex that's Salisbury University, on the edge of the campus.
That's just south, right?
South of campus. And we are working with a lab in Baltimore. It's the University of Maryland at Baltimore Lab to provide not only the specimen tubes, but the labels, and then they will run the test for us. And
so we'll be sending all the specimens, the nasal swabs up there.
Yes, it's a nasal swab, yes.
Right.
Not the one that you've probably seen that goes pretty far back in your nose, almost to your ear, but it'll just go a little bit into the nose.
That's good.
So it should be painless, should be quick, and then we're hoping to have the results. The lab tells us within 48 hours. We know that that might take a little bit longer when you're sending up thousands of specimens in one day.
Right, I know it is quite a few specimens. Yes. And so we're thinking it will take at least 48 hours to get results.
At least 48 hours, and it may be up to 4 or 5 days.
Now, how will people be made aware of their results?
So all people who test negative will get an email, and it'll be kind of a generic email that says you tested negative. You can continue to do your daily screening and monitor for any changes in your health. Any positives, we will be calling students, or I'll be calling students. Faculty and staff would probably get a phone call from somebody at Human Resources who's overseeing this for now. We are, hoping to hire another healthcare provider that will kind of oversee COVID testing for employees.
Right, and then you're focusing on the students,
yes.
Being student health services.
Yes.
And so obviously, what about students or anyone that is having signs and symptoms? They should go call their healthcare provider and get tested there accordingly, correct?
Right. We wouldn't want anybody with symptoms to show up for the screening procedure. Again, we're testing people who don't have symptoms, and that you should also have completed your daily screening to even come on campus. So anybody who tests for that day that we're doing the testing. So anybody that has a change in their health status or answers yes to the screening questions would need to contact Student Health Services if they're a student, and then employees would contact their primary care provider. And if they don't have a primary care provider, the health department is a great resource for testing.
We've been working quite hand in hand with them in terms of they'll be working with you with contact tracing and so forth?
Yes, the Wicomico County Health Department is certainly our partner in all of this, and they will be assisting us as needed with contact tracing for positive.
So just to reiterate, for this initial screening process where every student coming to campus, faculty and staff and so forth, has to get a virus test. It's by appointment only.
Yes.
And you will be keeping track of everyone who should be getting the test because they cannot come to campus unless they have a test.
That is correct. So there are people who've already had a test done because they're coming back to campus sooner than maybe move-in week. Employees, faculty and staff can send their results to Human Resources, and students can submit their test results to Student Health Services. The easiest way for students to do that is to make a copy of their result and send it to us in the secure Student Health web portal. Most students should know what that is because that's how they communicate with us, and that's where they send all their immunization data.
So you don't necessarily have to get the screening here, but if you get it somewhere else, it has to be made available to us to make sure people are all checked off to come to campus. Okay, so after this initial screening, then we move in over the course of the semester to what's called surveillance testing.
Yes.
And that too is required by the system of the University of
Maryland?
Maryland?
The system is wanting us to keep testing a sample of our population that's back on campus. Again, because once you get a test, that test is really looking at that one day or those few days when you get that first test. So we want to see what is going on our campus on an ongoing basis. How many people still are testing negative, which is what we hope, because everybody's going to be, wearing a mask and being physically distanced from each other and washing their hands.
We've heard this enough, haven't we? But it's very important to keep it up.
So we will be taking about 10 or 15% of the population and then doing random tests once a week.
And then we were talking earlier, and you mentioned there will be some targeted groups that have greater risks for exposure, such as nursing students who are in the hospital doing clinical.
Or some of our frontline workers, maybe people that have more interactions with others.
Right. So Victoria, to summarize, give us again an overview of what is happening with regards to COVID testing and so forth as the fall semester approaches.
Right. So everybody needs to have a negative test to be back on campus within 14 days of coming back to campus. We're going to do surveillance testing once a week once the campus reopens. So it's really important to check your emails, to check the website, to answer your phone if you're getting a call from Student Health Services or the contact tracing from the state of Maryland, which I think comes under a caller ID as COVID. So that's what's going to be important, yes. And of course all the other safety measures we've talked about before. As you and I know, we're both nurses. We cannot wash our hands enough. And wearing our masks and staying physically distanced from one another.
And wearing a mask even outside if you can't socially distance. Definitely required inside, we know.
Yes.
And I know we have lots of environmental protocols in place as well, so following those that are set up to keep everyone safe.
Yes.
So what is the name of the website where students can get any and all information related to COVID at Salisbury University?
Stay informed at SU.
Very good. So hopefully we'll have everyone cooperating and we'll be able to keep everyone safe this semester.
Yes, that is what I want and I think everybody wants.
Exactly. Well, thank you so much
You're
for
welcome.
coming
Thanks,
on the
Mary.
program. And thank you for joining us for this edition of Focus on Health here on PAC 14.